But here's your little spleen here. This is the stomach. So we're going to look at kind of the location and what it does, and then also the shape. As you can tell, it's a weird shape, right? And you're going to learn in more detail in Rain's class, the red folk and white folk, right, and what those things mean. But really quick, the spleen function, it basically does 4 things. I did put a star on this page, so as you guys know, important information for you to know. Makes blood proteins and red blood cells, protects against infection, stores iron and blood plates, and then it also filters blood. So it kind of removes those aged blood cells, right? And the platelets. They call it pitting. That's why you've got your lovely picture over here. I got shunted. Look what happened. This one was old. This one's still young and healthy. The body's going to allow it to stay there. But really what the spleen is, like we said, it's just one big, it's kind of like a lymph node, right? It does what lymph nodes do. But we can live without it because our bones make bone marrow, right? Our liver makes up for the other things that the spleen does. It's just harder for our bodies to heal and if we don't have the spleen, but we can live without it. All right, anatomy. It is convex, concave shaped, and the underside is the concave. So I put a glove here, a mitt. Have you guys play football? All right, a mitt. You guys have all seen a mitt, right? It kind of is like this, so you can catch that ball. And so this is the underside of the spleen. This is going to be the top part, the superior part of the spleen. And so that's what this mitt represents, is kind of like how this sits. So it's concave on the underside. You're going to need to know that. And it's convex on the outer upper side. And then you've got the arteries, splenic artery and vein. This, by the way, is highly vascular. Can anybody tell me why?
Because it filters blood.
Right.
Yeah.
It does a lot of work with our blood, right? And so it's going to be very highly vascular. So when you put color on it, it will light up. And if you don't put color and you see a lot of like anechoic areas, like massive, and you're like, oh my gosh, is that fluid? Put color on it. Color will decide if it's fluid around it or if it's vascular. Most likely it's just vascular. Okay.
Then how would you know if there's mass inside if the whole thing is very vascular?
That is specific to just a mass, right? So you're gonna hone in on that one mass and then put color on the mass and take a look at it. Yeah. And again, remember, we leave a lot of stuff up to the rads. We just have to describe it. Yes. So it's going to enter and exit at the splenic hilum, very similar to the kidney that we're going to talk about next week. The hilum is right here. This is where your catcher's mitt, where you're catching the ball, right? Right, like that. And so that's where they're going to go into. The average size, 8 to 13 centimeters in length. You guys are going to hear different sizes from like the textbooks and things. That Raina and I were talking about that because it's so annoying because the textbook is kind of old and it gives different numbers. And science is always changing, right? And so we give you the numbers based on what we're using right now in the real world. So if you see a different number in the book, don't freak out. Just go with the numbers that we talk about in class. So 13 is basically the biggest that you want it to go. Anything over 13, we call that splenomegaly. Splenomegaly. And if you break those words up, spleno means, what does megaly mean?
Enlarged.
Enlarged. You got it. So that would be abnormal. That means it's working overtime. Any questions about this?
Not so far.
All right. Yes, comment.
The position of the artery and the vein with the spleen, is that important?
You know the great thing is, gonna make you know it.
Cool.
But you definitely have to know the kidneys.
Yeah.
That is because if we do kidney transplants, right, we need to know if it's pedal or patafugal flow. We need to make sure it's going in the right direction. So if you ever get into doing, the, transfusions and things like that, the
Yeah.
kidney and the liver, you'll need to know those. But don't stress about it. One less thing you have to know, unless Rain wants you to know it. Rain.
Yeah.
We'll talk about it in my class, don't worry.
Perfect. All right, the location. Spleen comes in contact with the left kidney, the left splenic flexure, the stomach, and the tail of the pancreas, as you guys can see here. So the stomach is sitting here. Here's your spleen. And remember when we talked about the right splenic flexure, when we were talking about where like the liver lies and things like that. So the kidney is gonna fall right here into that left splenic flexure. And the stomach is close to it as well. And then you've got that tail, just that tail. Usually in pediatrics, you can see the tail. Once you get into like adult bodies, it's really hard to find a tail. Okay, so usually that means there's a mass or it's enlarged or something going on. So don't really think that you're gonna find it. But if you end up going into pediatrics, it is really important to know that yes, you can find the tail of the pancreas, and it's gonna be right close to that spleen. The other thing you wanna know up here in the left upper quadrant is, I actually was scanning a patient 2 weeks ago, and I had a hard time finding the spleen, and once I found it, it was because all I saw was this dark matter with low level echoes, right? And I was like, what the heck, but it was like peristalsing, and it was like so big, and this patient was in the ER, so he couldn't sit still, you know, and everything hurt, and I'm like, oh, I just took as many pictures as I could. Then I went back to my desk, I was like, what is this? Duh, it was actually his stomach. His intestines were swollen. You normally are not gonna see it, but, so for me it was a rarity because it was the first time I've ever actually seen a stomach by the spleen. But yeah, it was like completely swollen, and that's what it ended up being. Any questions about this?
What is left spleen? Flexure?
Left splenic flexure?
Yeah.
That's this guy right here, that's part of your large intestines. So we've got the ascending, the transverse, and the descending. And so right between the transverse and the descending is what we call the left splenic flexure. It's just kind of where it bends. Yeah. And really, the radiologists will care more about that than us. We're taking images, they're gonna know. I mean, again, I saw his stomach and I saw his intestines, but that's a very rare find. And I literally, to be honest, did not know what I was looking at. I was just like, what? I've never seen this before. And that's okay, you guys. It's gonna happen. And, but now I know, and I'm kind of excited. And now the next time I'm gonna be like, yeah, let's see if I can find this. All right, cross-sectional anatomy. So if we took it and chopped, this is what we're gonna see. We've got that spleen, we've got that kidney, intestine, and that tail. So everything we just talked about is kind of like, they're kind of like family chilling out. Yes, Miss Margaret?
I have a question, like, if you ever, like, encounter something, like, strange and stuff like that, are you allowed to, like, maybe, like, take pictures and, like, keep it, like, reference for yourself? Like, this is what that is, so that you can, like, look back at it.
Every site's a little bit different, so you always want to make sure you're asked. But if you ever take pictures, Lord, do not have name, ID number, or anything. And even if you think, oh, I'm just gonna take a picture and crop it, that the minute you take that picture, it's on the internet. So you can't just crop it later. It's there forever. So if you do take an image, it has to be like zoomed up, no names, no nothing on it, and just an image. Okay? And if you're not sure what something is, literally, I just go to my fellow techs, you know, I'll wait for them to be done with what they're scanning, and I'm like, hey, got a patient in there, I have no idea what this is, do you have any clue? And they laugh at me and go, oh yeah, it's this, and this. they've been there for 20 years, right? So they know. The only way to learn is to do. And we all know that in ultrasound, you're never gonna be perfect. It's just never gonna happen. You are constantly learning, and science always changes as well. But this just gives you a cross-sectional view of what we're looking at. All right, location, again. It is inferior to the left hemidiaphragm. That's a diaphragm we talked about, right? So it's inferior, and it's anterior to the left lung and ribs 8 through 11. So what does all of that mean? Hold on. Thought I had a better picture. Maybe we're gonna get there in a couple of slides. So that means we're way up here in the rib cage, you guys. So if you're scanning, over here you're scanning the liver, right? And you're like, okay, here's going on there. Oh, I found this, and you're staying in the safe neighborhood. When you get to the spleen, you have to go higher than you think. And it's funny because Rain and I could just drop a probe on and be like, there's the spleen, but I can guarantee you when we were in your chair, we would literally spend 20 minutes in our mind and we'd be like, find it, and start sweating, start freaking out, and be like, I suck at this, oh my god, if I can't find it, oh my god, it's ribs, and blah, 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 blah. And you're gonna do it. Even if I tell you not to right now, it's gonna happen, and then you're gonna be like, oh god, I can't find the spleen. Then you pee your pants. I'm just kidding. Alright. Yeah, you guys are gonna be fine. You just have to look higher and more posterior. It's gonna be between the rib cage, so sometimes you can't avoid getting a little bit of rib shadow. Okay, but it is high up in the left upper quadrant. That's why it's not in the left lower. And the kidney, I usually go for, if I can find the kidney or the spleen, I just kind of look, right? You guys have to make sure you just scan everywhere. Don't get stuck on going, oh, it should be right here. I did that. Doesn't work out so well. So just be flexible and be like, okay, I'm just going to look at what I'm working with here. And just kind of look in the area. And if it's easier to find the kidney, then find the kidney, focus on the kidney, and then you know right above the kidney is going to be what? Your spleen. If you find the spleen, you know just below is going to be the kidney. Okay? So definitely have to go way up here between these rib cages here. Okay, so the scanning planes. Patient is going to be in right lateral decube, or they're going to be in supine. For me, because I have a lot of big patients, I just roll them. Because I'm not going to do this and like break my back. I did that my first year, by the way. Don't do that. I did break my back. But like, I would like ruin my body mechanics trying to get like this, right? Roll. Sir, ma'am, I'm going to have you roll onto your right hip, towards me, facing me, perfect. And then right now you've got the towel here probably. You're going to have to bring that towel up if you need to on side, but you're going to have to bring that towel up, right? So either roll them, but look, you guys have little glass bodies. It's going to be easy to just reach and scan. So do it both ways so you can get comfortable. And remember, you're going to go higher than you expect to go. It's going to be a left coronal intercostal approach. So we're going left coronal. By the way, we always just write SAG for transverse spleen. So you don't have to annotate. Look, coronal. Oh, look. It's pretty obvious because it's the only place it can be. And SAG image. You're going to put your transducer. Here we go. Tanya, I remember you asked this in the first day of class. You're going to go to 2 o'clock and not 12 o'clock for your SAG image. Because you have ribs in the way. And now we're having to work intercostally. Okay? In the transverse image, the notch is going to be twisted to 8 o'clock. So the cool thing, you guys, that's just a 90-degree angle. So you're gonna get a mirror image. This is what SAD should look like. And then you're at 2 o'clock. You're literally gonna take your probe now. Go to 8 o'clock. Mirror image. And this is your transverse. So your length, when you're measuring, you're gonna measure from here to here for your length. You're also gonna measure here to here and transverse, because we wanna see which one we get the longest. Because we go based on the longest measurement for the spleen, okay? We also measure here, the depth. That way, if the radiologist needs to know the volume, you have 3 measurements to do the volume with. But we not only use volume, we use the longest length. That is kind of our do or
Spleen
die.
scanning planes.
What?
It's computer, not us.
They're measured right across from the spleen. Does it have to be on transverse, or can you do it in SAG?
You can do it SAG or transverse, it doesn't matter. I most of the time do it on transverse just because sometimes my transverse images, I can actually get a better image in that window. So you make that judgment as a sonographer, which one's giving you the true depth, and measure that. And does it hurt to measure both of them and then erase one later because one was better than the other? Okay? So, touch in, and this is for you. People have been having a hard time getting their brains like around this whole 3D ultrasound. What am I looking at? So I found images to help you guys. So you stare at these all week and try to like get your mind wrapped around. When we put the transducer on the left coronal side here, this is what you're seeing. So you've got your kidney down here, your spleen here, you've got the lung here, and then you've got that diaphragm. In pathology, you're gonna learn that if there is fluid here, what do you think that fluid's gonna be called?
Pleuritis.
Pleural effusion.
Pleural effusion, but it's gonna
okay.
be what side?
Left.
Left, because you don't always have
Yeah.
dual. And that's very important, because if you have pleural effusion, it needs to be drained. But the spleen sometimes can get injured as well, car accidents, trauma victims, things like that. And so you'll want to look at the spleen in a capacity of, is there fluid around the spleen? If there's fluid, is it ascites, or does it have low-level echoes in it, which would mean what? Probably burst. And so it's blood, right? Low-level echoes kind of like is blood, particles, things like that. If it's clean though, it's either ascites or it's gonna be pleural effusion. The difference between the two is this diaphragm right here. The diaphragm, if it is superior, then it's gonna be pleural effusion. If it's inferior to the diaphragm, it's gonna be ascites. Okay? And I'm just mentioning this stuff to you guys so that when you hear it again in Shay's class, it'll all click and come together. This is where your transducer is going to be for your kidney. For your spleen, you're going to be a little higher up where this red arrow is going. But this is the best picture I can find. And here are some more for those who are having a hard time wrapping their brain around this 3D stuff. This is pediatric right here, so this is a pediatric patient. But see, when you're putting your probe down, you've got the kidney, you've got the spleen. That's weird. Cross the spleen off here, that's stomach, where it says spleen. I should have caught that. The spleen is actually right here. See, this is why I say, don't trust images on the web. But this is what it's gonna look like down here, you guys. The spleen's gonna look like this. What do you think this dark thing is right here?
Lung.
a rib.
A rib?
Can't really avoid it sometimes. You're gonna try and try and try. Just don't spend 20 minutes trying to do it. Yeah. That's the worst thing you do when you go to your clinic, your clinical. You're like, 20 minutes later, she's stuck on the spleen, or he's stuck on the spleen, right? I just put it
Are
there.
these images in transfer?
This is a sad because it's the way it's going, right? And so this is what it will look like. You'll have your kidney. And a lot of places are gonna ask you to take this shot right here. And we call it the left kidney / spleen shot. Because they like to look at the tissue texture. Thank you. I just did that out. The texture of the tissue, right? Just like we do the liver. You guys, this exam today, that was a fatty liver, by the way, right? Because it was so echogenic compared to the kidney. And that's what they're gonna look for on that image. And then you'll take a sagittal and a transverse image. We don't even put color on. Do you put color on it, Ray, or at TRA? We don't put color on the spleen, do you?
Only if it's enlarged.
There you go. And then another visual, so you know your probe's gonna touch here. So it's touching on what side? Is this the concave side or is this the convex?
Convex.
Convex or concave?
Convex.
Let me help you guys. So convex, concave shape. The concave is where the hilum is. So you're touching the convex side. So this is your mid. The ball is where the stomach sits.
So that red is the,
This is the spleen. Right here.
And so our spleen is anterior to the rib?
No.
No, no, they just kind of faded the ribs away so you can see here.
That's
what it
what you
says in-
had on the other slide. So the
Yeah.
ribs anterior.
the left lung and the ribs.
Which one?
This one.
Right here.
Left
Oh.
lung and rib.
So it's anterior, it's anterior to the left lung. And it's ribs 8 through 11.
How can it be anterior? Wouldn't that be close?
Anterior to the lung, so the lungs are sitting posterior here.
But posterior to the 8 to 11 ribs, right?
I don't understand your question, Pete.
Like, our spleen is behind the ribs, right?
Yes.
Then
So
it's
if
like
we
on
layered
this.
it, we've got skin. I'll go back to this side. Where you guys can see. So we're gonna touch, the probe's gonna touch on the skin, then bone, rib, then spleen, and then if you go a little bit deeper, you may or may not see a lung. Most of the time you don't see lungs,
Yeah, but
unless
on
there's
this,
fluid.
on this, it seems like anterior to the left lung and ribs. Does that mean it's anterior to the
Oh,
ribs? 'Cause
just
it's not-
anterior to the left lung and near ribs 8 through 11. I see what you're saying. Okay, I will change that for the future, so it doesn't confuse students. Yes, it's anterior to the left lung, pause, and then behind the ribs, yeah. That makes sense, okay, thank you.
Toni?
Here again is more 3D pictures, okay? This is for those of you having a hard time with that concept. So you follow this red guy and the green guy. So if we're here on the patient, this is what it's gonna look like on the screen. So is this sag or is this transverse?
Sad.
Sag. Sag, transverse. Mirror images. Here we go again. I did a little 3D one for Connor here.
Yay.
So you can kind of see it's behind this rib, right? Kidneys here. Oh, sorry. This is the 3D. What I did is I took the right side because a couple of you were still trying to grasp around like the liver, like how do you chop the liver up? So I threw this in here, not to throw you off, but this is a liver right side. This is your liver, this is your kidney, liver, kidney, your ribs. So for those who are just struggling, I know a lot of you were, this kind of just a little visual to help. Okay, here is your sag spleen, your transverse spleen, like we talked about. They are mirror images. And you see on this one's measured in a sag, so it doesn't matter. Then you guys see this?
Yeah.
Don't freak out, what is that?
The high.
The hilum
Vessels.
vessels.
Right? It's highly vascular. So it's just the vessels. That would scare me though, and be like, is that fluid? Pop some color on that. It's pretty cool that you can see it. Alright. So the long diameter, greatest dimension of the spleen on a longitudinal image through the hilum. So you want to take the longest measurement, you guys. I always play with it. I start up here, and then I will go here, 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 and I kind of just find the largest area when I'm measuring. And then same with this side. Transverse, the greatest dimension on transverse image through the hilum, which is your depth and your thickness, really. All right, and again, camera at home. I've got your little fans here. You probably will be asked on your homework and your tests for this class to know how to label these. So we know we're lateral, but what lateral? Are we right or left?
Left.
Left lateral. This is gonna be your superior, inferior, and then medial. So we're here. Probe section. On my probe. So we know it's touching where? Left lateral.
Yeah.
How far is it going?
Medial.
Medial. Shay likes to say left medial, by the way, just to be very specific. Because if we were on the right side, it would be right medial. I found that when I was reading through some of my homework. Yeah, so I just want to make sure we're right with what Shay likes. All right, so we've got the probe touching here. We know what both sides of the are. So now where are we? Superior, inferior. So when we go transverse, I'm going 90-degree angle. Mirror image, but now what did we just do? Wrap your head around it really quick. I know most of you guys are like, oh God, I need to look at this. Did we change? Did we change this at all? No. So we're still touching left lateral to left medial. But what did we rotate? What's up and what's down? Yeah. So you've got your inferior, superior. This is going to be important. Let me tell you why. When you find pathology, and it's right here, you need to be able to know where that is. Or if you find pathology right here, you're going to need to be able to know. So, hold on really quick. Here is a good example. Can anyone, based on your little cheat sheet, tell me where this is in the spleen?
What kind of scan is it?
We're in sag.
Sag. Sag, it's
We're touching here. So this is left lateral. Left. And this is left medial.
left
So
lateral.
left medial, which on a spleen would be where? Probably near the hilum.
Yeah.
Isn't this confusing? Yeah, this one throws you for a big little loop here. Rain, what would you say?
I call it inferior.
Inferior? Because this is superior, or this is superior, this is inferior, right? So, you guys can kind of call it where you think it is. This is like the worst spot, right? This is like every ultrasound tech's like nightmare. This, by the way, is from Leah. I kept it from her PowerPoint because I wanted you guys to know like this is a nightmare. And just pray that it's actually going to show up here or here or here or right on the hilum. So I gave you guys did a little curveball. Now, if you described it though, how would we describe this?
Pathology or?
Echogenic, lesion, mass, structure, with posterior shadowing, located in, yeah, the most difficult place ever, thank you, close to the hilum, but inferior, close to the hilum, could say that as well.
It's look
And
like
then
a,
you would measure it in 2 planes. And you're gonna do, what else? Color, yes. Tanya,
it's look like a stone, but couldn't be the stone here. No way.
wait till you have your pathology class.
Okay.
Yeah.
And Toni, could we please?
Can the body calcify anywhere?
Yes.
Yes. So this is some form of calcification.
Could we return for previous picture because it's when we toning from the sage to transverse, we toning just to 90 degrees, not 180 degrees, but we toning from superior to inferior superior, like 180 degrees. Do you understand what I mean? How it could be?
Just 90 degrees, but yeah, I just turned. It's 90 degrees, isn't it? Or is it 180 degrees?
It's 180.
From 2 to 8.
Tanya, when she leaves me again.
Sorry, I just.
I always think of it as a 90-degree turn. Yeah.
It's not really transverse.
Yeah.
It's just sagittal reversed.
Well, just know you're going to get a mirror image. Not quite sure right now if it's 90 or 180, but I promise I'll look into it. Just know that you're going to turn your probe. Yeah, it's got to be 180.
Yeah.
I think I was taught 90 though from Leah. This is vodka. Yeah. Just make it look like that.
Mm-hmm.
I would star and highlight this page, by the way, you guys, because Shay will give you the assignments and you're gonna have to figure out where it's located. And if we look at this, this is saying this is lateral and this is the medial aspect. Even though we know that this is inferior, this is superior. Guarantee you're gonna have to draw this, by the way. Guarantee I remember, oh my god, I'm having nightmares remembering it right now. Yes, she is going to make you draw this. And you're going to have to know what's lateral, what's medial, what's inferior, what's superior, what's, all that stuff. Because we're touching here laterally, that's how I want you guys to think about it. So we are left lateral. Great. So this tip is closest to lateral. This tip is closest to medial. So if we look at this image again, now that we have a little more information, what could we say this is located?
The lateral inferior aspect of the spleen.
It's like in the middle,
Inferior, lateral. This is just the worst location. I'm just telling you right now. But if it's here,
Inferior
it's
lateral.
gonna be lateral, right? Yeah. Medial's gonna be down here. This is the only confusing part of the spleen. The spleen is pretty simple once you get over like your fear of finding it behind the ribs. But we'll have fun tomorrow because I'm going to be running lab tomorrow and I'm going to teach you guys how to flex along with your AAA protocols. So again, I'm just trying to throw you off, keep you engaged, make sure that So use this as your guide. This is your holy grail for spleen everything. And we've labeled your width, your length, everything for all your other classes you're going to need right this. All right, now there are some variants. You may scan a spleen and you're in Sag and you're like, what is that? That looks like tissue, doesn't it? updated slide from last night. If you didn't update your slide, sorry. I added stuff based on Shay's lectures. It's from my announcement.
Yeah.
Sorry. I know I hated to do that, but it would make lecture instead of 5 hours condensed to like 2.5. So this right here, this is not cancer, by the way. This is what we call an accessory spleen. See the tissue? You want to look at the tissue here. The tissue right there is the same tissue as here. Epigenicity. Isocoa. That is what's giving it away. And a lot of people have accessory spleens, so don't freak out and be like, oh my god, you have a large mass and it's vascular. It's just an accessory spleen. I guarantee somebody in here has one. And if you do, and you find out, you guys, don't share it with the rest of the group. Let the rest of the group figure that out. Right? And so it's just small islands of the spleen, usually located right near that highland, right? Where your catcher's mitt, right? Where the ball goes, where all the vessels are entering, that's exactly where you're going to see them.
But it's like outside of the normal spleen.
But
It's outside of the normal spleen.
yeah, always gotta be outside. So this is just what a accessory spleen. It just means it's like little remnants. Yes, dear.
Do we have to measure that one too, or is it?
No.
Wait.
Not unless it looks crazy and like has something on it, but most likely you're not measuring it. You're measuring the stone or the mass or whatever.
Is it the
Um,
spleen or is it not?
This is splenic tissue, so it is still part of the spleen.
It
Yes.
would be on the same capsule or their own capsule, their own vessels.
It could be a lot of different variants.
Okay.
You may see like 10 little accessory spleens right here.
Mm-hmm.
Don't be the new person now who like measures it and thinks it's a mass. Or do, because you'll never make a mistake. Right? So then we also have something called wandering spleen. What does ectopic mean, by the way? Ectopic location.
Not regular.
Outside the norm. So where do you think, if they have a wandering spleen, where do you think it's gonna be? The simplest answer?
Outside of the spleen.
Anywhere but where it needs to be, right? So it's probably gonna be lower or over or higher or more posterior. It could be anywhere. So again, if you have a wandering spleen, if you figure that out while you're scanning each other, save it so that your fellow students can figure that out.
So, like in the real world, if you're scanning somebody and you like can't find their spleen, do you just start looking all over for
Then
it?
you find it. You just find it. Yeah. Yeah. And some people, in the very rare cases, it's just like they're so gassed out or too big and you can't penetrate through. But I mean, most of the time you can find the spleen because it's pretty superficial. Yeah, it's not too deep. Yes, Sharon?
When you say wandering, does that mean it's in a new place every time?
No, they have wandered since birth. Like, as the body was developing and it was growing, it didn't go where it was supposed to go.
Okay.
It stopped, ascending, and it's like somewhere between where it started growing.
Okay.
You'll find when we talk about the kidneys, it's gonna be the same thing. You can have wandering kidneys too. So that's gonna be a fun one. Yes. I always find these ones exciting because I'm like, yeah, challenge. Let's find this. So asplenia, what does A mean anytime we put it before a word?
Absence.
Without. So splenic agenesis, the spleen never developed. So in that case, like you were asking Haley, there's no spleen. That's why I always ask my patients before I start scanning, do you still have your gallbladder right? All right, because I talk about, I say, today I'm going to cover this organ, boom, 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 boom. Do you still have all of those organs? And they say yes. And I know they're not paying attention, so I specifically say, so you still have that gallbladder? Yeah, no. Okay, great. 'Cause otherwise you're hunting and pecking forever.
Does it, on like the order that the doctor gives you, does it say the organs
And sometimes they forget that they've had surgeries, right, Ray?
Oh, yeah. Gallstones, they've had their gallbladder removed.
Yeah.
I
Yeah,
often
it
ask that
happens
question.
all the time. Yes. So, so don't be afraid of asking that question. You know, when you're new, there's a lot of things to ask, but eventually, write it down now so that you can review it in like a year and you'll go, oh yeah, Toni said when I go to clinical, I still make sure I ask this question. And then poly, what does poly mean?
Many.
Many. So what does that mean?
Many small
Multiple
spleens.
small spleens located wherever.
But it's more often would be retroperitoneal anyway, not somewhere in the lung cavity.
I've never seen one.
Okay, got it.
Yeah, but I look forward to it. And I tried looking at images for you guys, and it's so rare. So I couldn't find any images that I really liked that would make sense to you guys.
Do they work? Does this bleed?
That's a good question. I think it would depend on the individual and like, do they have vessels that go to it, that feed it?
So, for that, you have like one main spleen, and then you have a bunch of little baby spleens randomly.
Or maybe just a bunch of random baby spleens. Yeah.
Allow them mother?
Yeah, exactly. It could look any which way. The body is amazing and can do what it wants when it's developing. So, any other questions on this? The little variants? Most of the time you're gonna see an accessory spleen, okay? The other ones are so rare that, you know, let me know when you see them. Right? All right, that hard question. Okay, here's a spleen. What, are we in sag or transverse?
That's transverse.
Sag. Sag. And since we're in Sag, we know that this is labeled left lateral. This is medial. What is this? Superior. Inferior. So this little guy right here, where would you say it is located? Inferior.
Can you say that again, where our location is at?
Yeah, absolutely. So we're touching. So where are we touching? Left lateral. So we know that we're gonna be left medial here. And we know that this is gonna be superior. How do we know that? Because I just told you. You're gonna go home and
Just
memorize
the home.
it. And inferior. Okay? This one's kind of, just memorize. You're gonna try to wrap your head around it, it's just confusing.
You have to say left medial, or is that just a?
You can just say medial if you want to, yeah. So this would be inferior then. This one would be what?
Superior,
What would this one be then?
lateral,
Lateral.
left
Left lateral. And this one would be
left medial,
medial or left medial. Or where is this location?
near
Hilum.
hilum.
Hilum, near the hilum. Much easier to say, because that's actually more accurate, right?
Yeah.
All right, any questions? How are you guys feeling?
Good enough.
Not too much?
No.
I'm combining the lecture with the lab, kind of, that's what we're doing, so we're getting a lot done here. Okay, do you guys want a quick break before we talk about the GI?
Yes, please.
Yes, no? All right, I see more yeses than nos. Let's take a 5-minute break.